So, Dr. Tassine Lada. Tassine is an associate professor, the director of EDI for postgraduate medical education at the University of Alberta, and co-director of research and evaluation at the New Canadians Health Centre, Edmonton's refugee clinic. A specialist in pediatrics, she holds a Master of Public Health from Johns Hopkins University and has expertise in health equity, anti-racism, and community-engaged research. She was awarded the QE2 Platinum Jubilee Medal in 2022 for her tireless advocacy during the pandemic, which included media engagement at the local, national, and international levels. In 2024, she received the Women's Executive Network National EDI Leader Award for Champion EDI Initiatives in Medical Education, Research, and Healthcare Delivery. Dr. Lada is committed to bridging divides within and beyond academia and believes that fostering meaningful connection is the key to reducing polarization and building unified, equitable communities. We're extremely fortunate to be joined by her today, and without further ado, I pass it on to you. Thank you, Tassine.
Thank you so much, Michael. I'm excited to be here and talk about from division to dialogue, pluralism as a path forward. I would like to also acknowledge that I am an immigrant settler living, teaching, and learning on the traditional and unceded territory of Treaty 6 and the Métis homeland. And as I commit myself to reconciliation, I like to remind myself and others about the TRC call to action number 23, which calls upon all levels of government to increase the number of Indigenous health professionals, to ensure the retention of Indigenous health professionals in Indigenous communities, and to provide cultural competency training for all health professionals. So today I'm going to be talking about some topics that I find really fascinating and that I continue to learn about. So I'd like to explore the backlash that's occurring both locally and internationally against EDI initiatives. I want to understand the roots of societal polarization and explore some of the reasons that we're experiencing this. I'm going to be examining the role of pluralism as a framework for fostering constructive dialogue across difference. And finally, I'm going to propose some practical strategies and some examples of implementing pluralism, both in professional and everyday settings. So, I wanted to start with some criticisms of EDI. So, what are we hearing from critics of EDI? And I'm not saying that these criticisms are necessarily valid and that they need to be addressed, but they are important to understand and explore if we want to be able to make efforts more effective and move forward. And so the first one is the claim of reverse discrimination, which many of you may have heard. So the prioritization in EDI of historically oppressed or disadvantaged groups is thought to be at the expense of majority groups, and this creates perceptions of unfairness. And so this is often called a status threat. And so EDI initiatives are viewed as a zero-sum game where there are some winners and some losers. And members of the minority group, when they make gains, this poses a status threat to members of the majority group who feels they will incur losses if this occurs. EDI also has this perceived ideological agenda. So it's thought by many people to be a left-leaning ideology. And so this frames it as a divisive partisan agenda rather than something that addresses universal goals. Critics also contend that EDI promotes identity politics, and it does this by promoting differences, which they believe creates division rather than unity. And finally, for some, EDI represents an attack on traditional values and thus creates resistance from groups that feel threatened by social change. And so, an example of resistance to change would be those individuals that believe that hard work and individual merit are the main factors in success. And so, we might hear them say things like, somebody else can just work hard and achieve the same things that I did. They can pull themselves up by their bootstraps. But as many of us know, not everyone even has boots in actual reality. But what's happening here is that these people are facing a merit threat. So acknowledging the existence of bias and inequity is thought to explain away their own successes as due to privilege rather than their own hard work. And so, as an EDI practitioner myself, somebody who's been involved in these efforts in the postgraduate medical education office at the U of A, I wanted to explore why the EDI movement is falling short. Because many of our EDI initiatives have failed to meet their intended targets. And I think it's important to understand what a better approach or framework might look like. And so, one of the first reasons is that many EDI initiatives are tokenistic. And so, we can see here on the slide that for Pride Week, many companies change their logos to be rainbow colored. And although this signifies inclusion and safety, many organizations don't follow this up with any meaningful change. And so, thus, there isn't really efficacy. This becomes superficial or symbolic. There's also limited evidence around what strategies are best to help someone reduce their biases. And so, something that is widely distributed are the IAT tests. So, these are the implicit association tests. They were developed at Harvard and they're given to many admissions committees or hiring committees prior to their selections as a way for individuals to become more aware of their own unconscious biases. However, when you actually look at the evidence behind these IET tests, it's mixed at best. So there isn't good evidence that this actually helps somebody become aware of their biases. And certainly there isn't good evidence that it changes behavior. There was a meta-analysis published several years ago of prejudice reduction interventions, the sources at the bottom there, and it showed that few actually achieved their goals. So, moving on to another reason that the EDI movement isn't quite attaining what it hopes to is lack of measurement and evaluation. So, in many cases, EDI programs may not measure metrics or conduct evaluations of their initiatives. And so, we don't know what's working because it's often not measured. And this contributes to our inability to ensure that these initiatives are meaningful. Um, and of course, there are inherent challenges in measuring whether these initiatives are helpful or effective. So, within the postgraduate medical education office, for example, one of our stated goals is to improve diversity of residents admitted to reflect the community they serve. But we don't ask applicants or residents their demographic information, and it would be tricky to ask them to identify in certain social categories. So we don't have that information, and thus we can't compare in the future whether diversity has increased. For me, I think one of the main reasons the EDI movement has faced a lot of backlash is because of its polarizing framing. And that's the framing of EDI in terms of privilege and bias, which can really alienate individuals who then feel blamed. Um, and privilege, unfortunately, within the context of EDI is often framed as a negative thing. And this constitutes a moral threat to individuals. So if we acknowledge that we have bias or we link ourselves to an inequitable system, this tarnishes our idea of ourselves as a moral individual. And I just want to delve a little bit more into this idea of privilege. So, when we teach about EDI, we usually teach about privilege as a packet of unearned assets related to our social identities or social categories to which we belong. But unfortunately, in the EDI movement, it's become privilege has become framed as inherently a bad thing and weaponized against people. So you'll hear people say, check your privilege, or you're so entitled, you're so privileged, and this is name calling in a derogatory way, which causes validly shame, guilt, defensiveness amongst people, and also perpetuates divisiveness, which is exactly what we don't want to occur. So the current framing doesn't recognize the nuances and the complexity of privilege. So We know that having privilege does not make someone a flawed or bad person. It's not a character flaw. Those with privilege can also face hardships and barriers. And one can be privileged in some ways and not others. And that's, essentially what intersectionality is. We have intersecting social identities that create our lived experiences. And so it might be more useful to think about privilege as a systemic issue or an issue with society rather than an individual character flaw. And so there was an article published in Forbes magazine just a few years ago entitled, "Privilege is Not a Dirty Word." And I pulled this quote from it that eloquently explains why many feel resistant to the idea of privilege. So, certainly, it's important for individuals to acknowledge their own privilege and their roles in a system that perpetuates inequities. But then what? What do you do with that knowledge? Ideally, we use it as a step towards empathy and shared understanding, but I don't think that that's something that's been very well discussed within the current EDI movement. So we see that there are both individual and systemic manifestations of backlash against EDI. And so starting with some of the individual manifestations, we see that people will defend, they'll justify the status quo by seeking to legitimize it. We also see that there are people who deny, they downplay the existence of inequality or bias. And then there are people who distance, so they argue that they are unbiased. They might say, "I'm colorblind, I don't see color," those sorts of statements, which don't acknowledge that we all have unconscious bias. It's inherent to the human psyche. There's also systemic manifestations of the backlash against EDI. And I think a lot of this backlash first began in the US before moving up here to Canada. And I have some examples that affect both corporate institutions as well as academic institutions. And you can see that these are really big companies with a lot of power, a lot of wealth, a lot of influence that are discontinuing their DEI, which is what they call it in the States, their DEI programs. And so Walmart, for example, it's the largest retailer in the world. It makes over 600 billion in sales yearly, and in the U.S. alone, they have 1.5 million employees, and they've ended racial equity training for staff. So this has huge impacts on people. And they're also reviewing their supplier diversity program. So currently, Walmart has goals to ensure that their suppliers are at least 51% owned by women or other minorities. And this is a program that's likely to be discontinued. In terms of academic institutions, there's backlash against EDI here as well amongst universities. And this is even more concerning to me than the corporate backlash because universities have a really strong role as independent civil society institutions that should be protecting democracy and free speech. And so we can see in the US that the University of Michigan closed its office of DEI, and at MIT, amongst other places, they're reevaluating DEI practices in hiring and admissions. And we can see, unfortunately, that this movement, this backlash has come to Canada, and some of the first examples, unfortunately, have happened right here in Alberta. And there's the rebrand at the U of A of EDI to access, community, and belonging. And I think we need to look at the political context in which that occurred. And so this rebrand came after a UCP annual general meeting, which occurred last fall, in which a policy resolution targeting EDI funding as well as EDI in hiring and training practices was passed. Aside from corporate and academic examples, there's also examples in the public sector. So Aimco, a Crown corporation in Alberta, fired their sole employee in charge of EDI initiatives recently. And then in the US recently, a list of words was leaked that can cause research grant funding from the NSF, the National Science Foundation, to be pulled or denied. And this list of words included things like women, as well as racism, oppression, bias, social justice. And what I really wanted to point out here is that it also included words like community and belonging, which were identified here at the U of A as potentially being safer words. They were also on this list. So, um, this backlash against EDI is occurring in the context of deep societal polarization, which is important to understand because it impacts how we move forward, what approaches might work, and what resistance may be encountered. And so, what is polarization? It's this division of society into opposing groups that have become really distant in their positions. And this often results in blame and scapegoating. And so, diverse positions in themselves are not problematic, but attacking and vilifying the other side based on their viewpoints is what is harmful. And this is what is occurring. And so, I've pulled a quote here from Dame Louise Richardson, who was the first woman to lead Oxford University. And she says, polarization is a mindset that assumes those we disagree with are nefarious or bad in some way. And that is deeply unhealthy to our democracy. And so there are so many contributors towards societal polarization. And I've come up with a pie chart here of some of the ones that I think are really important and relevant at this moment in history. And the polarization is a result of actions of individuals and organizations, but also the result of political and global events. So there's a movement in politics and amongst parties towards extremism. So sides are migrating further and further apart in their ideas and policies. And there's also a number of situational factors that have contributed to polarization. So the pandemic was a major one, economic instability, the recent US election, geopolitical events like the wars in Gaza and Ukraine, all of these are contributing to increasing societal polarization. This is a chart I actually found on the Obama Foundation website as other contributors to drivers of polarization. And these include things like social media, biases, inequities, traditional media, misinformation, and even information abundance, all of which are contributing to divisiveness. And so I wanted to delve into some of the drivers of polarization in more detail. And one of these is the focus on binaries. So this is viewing things as all or nothing scenarios where we think something is good or bad, or we're pro or anti on certain issues. And the reality is really more nuanced than that. And we can look at a couple of examples, both in the US and here. So the gun control issue in the US has often been presented by the gun lobby, for example, as binary. You're either pro gun legislation or you're anti gun legislation. You want gun control, or you want guns everywhere, or you don't want any sort of really binary presentation. But in reality, when polling has been done of Americans, it shows that even those who support gun ownership want some elements of gun safety. And in 2022, Congress actually passed some gun reforms, and many Republicans voted in favor of them. And if we go to a more local example in Alberta, we can look at safe consumption sites. So this issue has often been presented by media and political parties as an all or nothing scenario, that Albertans are either for safe consumption sites or they're against safe consumption sites. And this sort of framing actually convinces Albertans that there's a deeper divide than actually exists. So statistics show that almost half of Albertans support safe consumption sites, but most Albertans believe that the support is much lower, around 20%. And so sometimes we're given this perception that there's more division or opposition to something than there actually is. Another growing sentiment that's contributing to polarization is writing off of the other side. And this really assumes that people and their perspectives are unchangeable. So the author of this book, The Persuaders, Anand Giridharadas, he's a foreign correspondent and a former columnist at the New York Times. And he's taught journalism as well at the New York University. And he talks about writing off the other side in his book, The Persuaders. And I really like what he says about it. He says that it's rooted in the assumption that people are too invested in their interests to change, that people and their opinions are monolithic and strong. And the purpose of politics is to protect yourself from others and galvanize your own instead of trying to reach across. Trying to reach across was something that used to be done. And he talks about this in the book. It used to be done. It used to be done by individuals, by groups, by political parties, but not anymore. And this has been of major detriment to society. So another aspect of writing off the other side is cancel culture, which is also contributing to polarization. And so individuals and organizations face backlash or punishment or social exclusion because of something they did or said. And of course, there has been utility to this. For example, when there have been celebrities doing illegal or morally reprehensible things, but it can lead to overcorrection or suppression of dialogue when people are canceled without due process. So being very quick to cancel someone can lead to fear amongst people who may have different viewpoints. And I'm not saying that we need to platform all viewpoints. We don't need to platform viewpoints that are hateful or discriminatory. But I hear from colleagues, from families, from friends that they're scared to say the wrong thing. They're still learning, but they're scared to ask questions because of the possible repercussions of being shamed, and not only shamed, but publicly shamed, because now we have social media where this can occur. And so there's a lot of vilifying of social media, and I personally think there are benefits to it. I have found in my advocacy work that I've been able to reach people that I normally wouldn't have been able to reach without the benefits of social media. And so it does serve some positive purposes, but it also has contributed to really deep divides. And I think one of those divides is the dehumanization of others. And so disagreements or conflicts, especially on social media, become conflicts over identity rather than just the issue that's being talked about. And there was a social media post that alluded to men who are right wing as strong, physically strong, and ones that were more left leaning as weaker men who support the welfare state. And so the implication is that these individuals are flawed in their very being rather than just in their views. And this imbues attributes to the individuals themselves as, weak or lazy or disgusting, and this dehumanizes them. And I think this happens so much more on social media because people are emboldened to say things that they would not otherwise say face to face to someone. And the conversation devolves into labeling and insults and even hate speech. And this is a way of othering people. And this is really far from the civil discourse we need to create in order to have some progress towards empathy, understanding, and inclusion. So another aspect of polarization I had alluded to was political extremism and political interference. And so I recently learned more about the Internet Research Agency, which is a Russian company that was working on behalf of Russian intelligence. And its mission was to further existing divisions in the American public and decrease trust in democratic institutions. And basically, what it was a troll factory. There were tons of people hired to post on social media misinformation, but not just misinformation. They exploited what was already occurring in North American society, this concept of the write-off. And so what this company did was exploited the write-off. They propagated the belief that people are entrenched in their views, that there isn't openness to discourse, and that if someone disagrees with you on certain issues, they must be abhorrent or less than human. And by doing this, they were really able to um, solidify this societal polarization as well as creating distrust in credible sources. So, unfortunately, there's many local examples of political interference that we can draw from here in Alberta. In particular, I think this is an unprecedented time of political overreach in science, healthcare, and health policy. And two prime examples are Bill 26 and then the Pandemic Task Force report. So, Bill 26 concerns gender affirming care, and it really highlights the interference of the government in the relationship between a healthcare professional and their patient. Bill 26 also is framed as protection of minors and prohibits sex reassignment surgery less than 18. Sex reassignment surgery less than 18 does not occur in Alberta and has never occurred in Alberta. And so this framing as protection actually implies that health professionals are negligent or almost predatory if they pursue non-surgical gender affirming care for youth. The second example, the Pandemic Task Force report, and you can see some of the headlines on the right that were in response to the publication of this report. It costs $2 million and it discourages the use of COVID vaccines that have saved hundreds of thousands of lives. And it was called out immediately by both local and national health and science bodies as scientific misinformation. Um, and this appropriation that we're seeing of health policy by the government, I think is partly a product of the pandemic in which things like masking and vaccines became very adversarial topics and polarized topics. And this was really leveraged by political parties to advance their prospects. Silencing is also a form of political interference that causes polarization because it damages the tenets of democracy and free speech, especially the right to be able to criticize the actions of government. Um, so, citizens fear punishment if they speak out about issues important to them. And this is happening more and more. Alarmingly, we're hearing about customs officials at US borders looking through personal cell phones. Locally, there's allegations of Alberta Health Services staff being targeted for demotion or dismissal due to government criticism. And this leads to further polarization because um, the groups that are blamed, the groups that are silenced blame the other political side when silencing and punishment occurs. So what do we do about this? This is a turbulent time. There is a lot of divisiveness. How do we move forward? What is the path? Um, I'm going to introduce the concept of pluralism as an approach to decreasing polarization. And I want to be clear that I'm not saying EDI efforts should be abandoned in favor of pluralism, but rather we use the pluralism approach to advance some of the goals of EDI, but also to achieve additional goals of bringing back civil discourse and encouraging humanization and empathy. So what is pluralism? Pluralism promotes the idea that society benefits from a diversity of views, and the diversity doesn't need to conform to a majority perspective. Diverse opinions are actually considered opportunities. In pluralism, we think of diversity as this fertile ground where there's flourishment of ideas. It really is celebratory of diversity, not just tolerance of diversity. And it's embracing diversity to achieve a shared vision for the common good. Um, and so it's like I said, it's about celebrating diversity, understanding that inclusion and collaboration really are essential to solving the big and complex problems that we're facing today. So this is a definition taken from the Global Center for Pluralism, which is a nonprofit organization in Ottawa. And it says that pluralism does not mean the elimination of difference, but the embrace of it. It understands that diversity does not weaken a society, it strengthens it. And a genuine sense of pluralism in an ever shrinking, more diverse world is indispensable. So it's not just ideal, it's not just something that we should strive for, it's actually indispensable for human peace and progress. So, what pluralism is not? Pluralism is not platforming views which are discriminatory or harmful. And I took this quote from the Common Ground Initiative, which is actually local here at the University of Alberta, a research initiative which aims to safeguard pluralism amongst other objectives. Um, they say that pluralism promotes the diversity of views in the public sphere, ensuring all voices are heard and considered as long as they respect the dignity, safety, and rights of individuals and groups in society. So we're not platforming hate speech. Um, we're also not necessitating agreement or assimilation. And this was a concept taken from the Calgary Pluralism Initiative. So connection does not necessarily mean agreement. It does not mean we want to eliminate our differences. It means we want to connect to learn from each other and build together. And this results from daily decisions taken by institutions, organizations, and individuals to recognize and value human difference. So, why am I proposing pluralism as a way to approach EDI initiatives? Because it is a framework that's beneficial to all with an approach that is less shaming and more collaborative. So, I'm just going to introduce the work of Lily Zhang to show why pluralism can be an effective path forward. She's a sociology scholar, an author of multiple books, and a DEI strategist in the US. And she's written a few articles that have been published in the Harvard Business Review, but this one was recent in January of this year. And it's entitled What Comes After EDI? And she proposes a framework called FAIR in it, which stands for fairness, accessibility, inclusion, and respect. And she talks about FAIR as being outcomes based, so there's measurable results. It's systems focused, so rather than focused on individual awareness training, unconscious bias training, it's coalition driven, so it engages groups of people. And it's win-win, so it addresses that zero-sum game concern of EDI, where some people are potentially losing and some people are making gains. So it's focused on creating better outcomes for all. Now, if we look at pluralism, we find that this is already an established approach that addresses many of the issues encountered by EDI. And so, we don't need to reinvent the wheel. We don't need to create new frameworks. We have this existing concept, this framework that already integrates many of the strengths of the FAIR model, and it can be used to advance EDI initiatives. So pluralism is values-based. There's respect for difference, inclusion, and justice, and that redirects from reducing bias to universal values of fairness and respect, and that avoids the polarizing framing of EDI. It focuses on systems and communities rather than just individuals, so it puts more of an onus on organizations to make lasting and sustainable change. It has a commitment to the common good, and that addresses the status threat of EDI where only certain people are thought to benefit. So shared goals decreases conflict, and it engages diverse groups of people and emphasizes communication across difference. It allows for this assumption of others as inherently good whilst still being different. And this fourth point, I think, is so important because nobody seems to be able to talk anymore. People can't converse across difference. They can't dialogue around disagreement. And that's a huge issue. There's this lack of role modeling, and as a pediatrician, I see this and I'm worried about it. There's this lack of role modeling of civil discourse that is really impactful on children. They're not learning how to navigate disagreements and differences, but they're staying entrenched in their own silos. They're learning to blame, they're learning to divide. And so, like I said, rather than seeking to create a new concept, we can utilize one that already exists that mitigates some of the issues encountered within the EDI framework and has the additional benefits of encouraging conversations across difference and decreasing polarization. So, pluralism is recognized locally, nationally, and internationally. I talked about Common Ground, which is an initiative right here at the U of A. There's also a U Calgary Pluralism Initiative, which involves research, teaching, and innovation. And in fact, at the U of C, you can take courses and get a certificate in pluralism. The Global Center for Pluralism, which I alluded to earlier, is on Sussex Drive in Ottawa. So it's a collaboration with policymakers in addition to community members to inform policy and advance pluralism. And then there's a number of other nonprofits, community-based organizations, foundations, such as the Obama Foundation, which are integrating pluralism in their approach to solving some of the big issues we're facing in society today. The other big benefit of pluralism is its generational thinking. Right now there's a lot of policy making, a lot of change based on a 4-year election cycle. We propose ideas based on who's going to be elected next. Pluralism is not about that. Pluralism requires patience because it is focused on long-term change. We're thinking decades ahead. How is this going to benefit not our children, but our great-grandchildren? And that sort of systemic change takes time. So there are applications of pluralism on an individual level as well as systemic levels, such as in academic institutions, in research and policymaking. So this is an approach to pluralism as an individual adapted from an Obama Foundation practical skills guide. And these are skills like making room for all voices, dialoguing respectfully, collaborative problem solving, and taking responsibility for upholding equity and justice. And so some of these skills are similar to things we utilize when doing EDI work. So really approaching things with curiosity, empathy, and reflexivity. Another example of pluralism in practice, and so approaching healthcare conversations from a pluralistic lens. And I encounter this in clinical practice all the time. Families that may like to add treatments that aren't necessarily evidence-based, homeopathy, for example, to a treatment regimen. Recently, I had a child whose family wanted to do this for an autoimmune condition. Um, and really, what we're doing in these conversations, we're listening to understand, we're acknowledging and validating the perspective. So, again, that doesn't mean we're agreeing with their view, but we're validating that, yes, there's a desire to find a cure. There is information that is hopeful about homeopathy online. We're validating some of these things. We're then engaging in respectful dialogue, not debate, but rather curious, open-ended questions where we're not trying to win, but we're trying to understand and portray our point of view. We're then identifying shared values. So in this scenario, all of us want what's best for the child. And then we offer evidence in a humble rather than a paternalistic way. And I actually find these conversations are an opportunity for me to learn, not just about the family, but about treatment options, about um, information or evidence or things, information that exists that I wasn't previously aware of. So usually I'll go and look things up and come back to the family. And this may not seem like pluralism, but in fact it is. It espouses the values of pluralism and that respect for a diversity of viewpoints. Another application of pluralism is how it can be used to facilitate dialogue at academic institutions. And so the president of Wellesley College in the US recently said, We hear from students across the ideological spectrum that they don't feel they can engage with each other, which runs contrary to the mission of higher education. And this is scary, right? This is happening everywhere. We're finding students in schools and universities where they can't actually dialogue across their differences. And so what Wellesley College did last year is they established a pluralism initiative. And what they did was they provided an open forum for students and staff to engage with a diversity of ideas. And this was established independent of the office of the provost, so there could be safety involved in this expression of ideas. Um, they engage thought leaders in these discussions. They invite scholars on complex issues such as the Middle East to come for roundtable discussions. And they also, very interestingly, have simulation labs, so civic action labs, where they practice working across difference. Another example of pluralism in action, so pluralism as a way to advance equity. So I had the privilege of being at the Global Pluralism Award ceremony in 2023 in Ottawa, and I saw one of the winners, which was Redin, an organization based in Oaxaca, Mexico, win one of the Global Pluralism prizes. And so Redin is a collective of Indigenous youth that provides Indigenous language interpretation with a human rights approach for Oaxacans involved in the justice system in Mexico and the US. And so Oaxaca is a very diverse and fascinating place. It has 16 registered Indigenous groups, but over 177 linguistic variants. And historically, Indigenous communities in Oaxaca have faced a lot of racism, and so they often migrate to other parts of Mexico and the US, um, where the justice system is either in English or Spanish. And so there are these Oaxacans that get engaged with the justice system, and in many scenarios, interaction with Redin is the very first time that these people are even hearing what the charges against them are, and are then able to have an opportunity to respond. We also can see pluralism's applications in research and health policy. And so there was a study done at the U of C published in 2023 that looked at community water fluoridation in Calgary. Community water fluoridation in Calgary was discontinued in 2011. Edmonton still has fluoride in their water. In Calgary, this remains a huge point of contention amongst policymakers and health experts. And this study examined the application of track two diplomacy to this public health issue. Track two diplomacy is also known as citizens diplomacy. It involves non-governmental actors like academics, civil society organizations, conflicting parties basically coming together in an informal dialogue that's facilitated by an impartial party in order to aim for collaborative problem solving. And it's been used in international conflict resolution, and now it's being considered in public health conflicts. So in this particular research study, they aim to examine whether facilitated discourse might help transform the policy issue in Calgary. And they engaged scholars, health experts, civil society representatives, and interviewed them afterwards. And they found that participants expressed some optimism that this sort of discourse could help reframe an issue as binary, win-lose, which is one of the things that we talked about contributing to polarization, reframe it from binary to a more constructive conversation about child health. So the shared common goal of child health. So really a whole reframing where track two diplomacy is used as a tool of pluralism. And so, I want to summarize by talking about what pluralism is. So we talked about it being values-based, emphasizing fairness, respect, equity, justice, focused on sustainable changes to systems so that they're long-term, and they mitigate the low efficacy of individual training, and espouse generational thinking. involve engagement across diverse viewpoints to collaboratively develop innovative solutions, really creative solutions to complex problems, because these complex problems are going to require innovation. They're going to require a diversity of perspectives to come up with a way forward. And an emphasis on the common good. So shared goals, shared understanding, empathy, humanizing each other. I'm not saying we abandon EDI related goals. Rather, we adopt a pluralistic lens to achieve these goals in order to mitigate issues associated with the EDI movement as it stands, and also use a pluralistic framework to decrease polarization in our organizations, communities, and society. And I want to leave you with this image. It is a visual representation of pluralism in Houston, Texas. There are 7 statues. They're really large that look like this, and they represent the 7 continents. And they're created with metal, and they're created with the characters and symbols from 9 different languages, and they're called the tolerance statues. So with that, I will end and open it up for questions and discussions. Thank you so much.